I'm Debbie Briedwell. I'm a GIS Manager with the state of Missouri, and I've been working pretty much full-time for COVID right now. And so I just wanted to talk to you about our program at Missouri and some of the things that we've done through our GIS program that I think has helped a lot with our activations of this. So just a little background, we have one full-time dedicated GIS person in our Department of Public Health through the Public Health Emergency Preparedness Grant. And that position has been there for a long time, back in 2002 when we got funding for bioterrorism through CDC. That position was set up, and so we have a long-standing relationship with our public health emergency responders. And so I think that's pretty important for the work that we've done. And so we started out, we have 117 local public health agencies, and our main objective is to make sure that they have the tools they need to respond for a public health emergency event. And so we used to provide them ArcGIS desktop software, and we would train them on how to use it. And over the last few years, we've switched so that we now have an ArcGIS online organization, and all of those counties have, or all of those local public health agencies have accounts on there, and we teach them how to use those online tools rather than having to learn ArcGIS desktop. The other thing that we have is community analysts. We have licenses for all the local public health agencies there too. And then we train them on how they can use that to make really better informed decisions on where their vulnerable populations are, specific age groups for if they need vaccinations, things like that. And so this is has been an ongoing thing before we started this COVID event. So back in March, we were really all kind of scrambling just like everybody else. And we just needed to get some situational awareness. And I'm sure you guys are all aware of the Johns Hopkins dashboard that was put out. And that's what everybody was looking at. And so the first thing we did is we took that and we modified it so it's for the state of Missouri. That was probably the best thing that we did, because when we started out with, 1 case, 3 cases, 5 cases, what you see here is March 30th, and you can see we were up to 1,000 cases in Missouri. And so first we started pulling the data from the Johns Hopkins data feed, and then we were able to start bringing in our own data. And so over time, this has been a really, really important tool, and so we've modified it, we've added data. When you first start out and there's just not data available, you're really not sure what to even do, and so we've been really flexible, and this is actually that same dashboard, but this is what it's morphed into over the last few months. And you can see there's a lot more data available here now, and we meet often and decide, one thing that we recently added was a 7 to 8% positive for the testing. That's something that people are really asking for, and so we're able to modify the board, and so to start pulling that data in too. For testing, first we didn't have any testing tabs, and then we were able to add one for testing. As we got more testing, we split it out in between the PCR and the serology. We actually have an antigen testing tab that we're getting ready to add now. And so just using this platform has been really flexible, and we've been able to modify it as we need. And I told you that our local public health agencies have accounts through our organization. And so because they've had the training and they have the account, they've been able to go in there, and they've also been able to do situational awareness. They've been able to create their own dashboards. This is their data. This is their dashboard. But we gave them a platform to be able to do this. You can see there's quite a variety of what some of them have done. There's Jefferson County there. They've got a place where the public can go in and they can report if they've had a possible exposure to just displaying maps and the daily data numbers there. The other thing we did, very first thing, we put up a GIS Hub through our ArcGIS online organization. And this started out a little smaller. but we wanted to make sure that people could get to whatever we were creating. And so first thing, we put the dashboard up there. We have some tools that we wanted people to have that we had already developed. There's a social vulnerability index that we already had, that we wanted to make sure that tool was out there so that people at the local level could have that. There was a lot of concern with schools being closed and how are we going to feed, all these kids, and so we quickly created an app and pulled in the data so that they could see where the food programs were for the summer foods that they had switched over so that they were using in the spring. And so this was a really great tool because we can just keep adding to it as we have more information come through. Another tool that we developed in order to assist our local public health agencies was through the community analyst. And this is actually an infographic tool. And so for every county, we set it up so that it would go in and it would pull out all that information that we thought that they might be interested in. And this actually goes to a web app builder application where you can select your county and then it creates this report for you. Like I said, we did this early on, and we were in constant contact with Esri and other agencies that were also doing the same type of work we were. And following this, Esri actually took our model and then perfected it a little bit. And so this is actually pulling in the data for COVID plus that vulnerability information also. And so they were able to take what we had and build on it and make a better product and then, share it out with everybody else. Which I think was a really important part of this response, is that everybody was just kind of doing the best they could, but working together and making things better as we go. Another big project that we had was our PPPE ordering system. They were using paper to try to take these orders in and go to our warehouse and send them out. And so we were able to create a survey 1, 2, 3 that the different hospitals, dentists, anything that needed PPE, they could go in there and they could say, we need this many masks, we need this many gowns, whatever it might be. And so when they enter the survey, we have it set up with the webhook so it emails our warehouse and says somebody put an order in. And then we use the crowdsource manager, and so they can go in there and see what orders have been submitted, and then they can either approve it, they can partially approve it, or they could deny it. And so from there, once it's been approved, we use a web app builder and an infographic to create a shipping slip for us, which is printed, and then the item is shipped out. And so all of this was done through our GIS system. They were working with an application developer in the state to try to get this built, and they're actually, I think, still working on that. So it's like we were able to get this up in a few days, and they've been using it for months now, and it works really well. On the other side of things, one thing that we have really been concerned about is how is COVID going to affect our workers. And so something that was done was we set up a survey that was sent out to the different responders, first responders, EMS, fire, law enforcement, and then also our correctional facilities. And so that we could keep track across the state of who was having problems and who was doing fine. And so the hope is with this that if there's an area where COVID is high and the first responders are really affected, we could look at this and see who's nearby and is not affected and might be able to help out. Same thing for long-term care facilities. This is an internal application that we can track the long-term care facilities. We can tell who has positive cases, what do we need to be concerned about, who is also low on PPE and things like that. So it's a way for our public health officials to keep an eye on that statewide. And then on a higher scale, we had an executive hub. So this is actually at the governor's office and our office of administration level. And so the idea of this hub was to give the upper management a picture of what's going on in the state. And so what we see here is a facility status. We did go into a closure where they closed most of the state buildings. And so by using this application, we could quickly look and see what's closed, what's open, what are the restrictions on that. The other thing that we need to track is our employees. You know, is our workforce affected, and are we able to perform our jobs? And so one thing that we have is a form that people fill out if they have an employee that is positive. Besides employees, it also covers individuals that are in our care, so that would be like prisons, special needs facilities, juveniles, juvenile detention centers, and things like that. And so this also gives us an idea of what's going on in our facilities. And so as part of that same data, the Division of Youth Services that has these different youth facilities, this was, you're able to take that data and put it out into a public viewer. And so concerned families could see, you know, if they had children that were any of these youth services centers, what it looked like there. And so just trying to keep everybody informed. And then lastly, when it comes to making sure that we can do our jobs and, you know, everybody is able to perform as they're supposed to, there was a survey that was put together, and actually every manager that works for the state fills this out every morning or at the start of their shift. And you put who you're reported to, and you for the people that you manage, what is your impact, your citizen impact? Are you still able to do your job? If it's green, or no, you know, we're so impacted that we can't do it, and that's red. And then you have staff that's out because of COVID, or are you not able to work because your building's closed, but you're healthy, but you just can't work. So tracking all those things, and then what is the impact on your team also. And so that data every day is taken and is pushed into this operations dashboard, and it quickly gives you an idea of how is our workforce, how is our citizen impact. And you can see right now, this is current from last week. We're actually doing really good. It took us a bit, you know, when we all closed down all the buildings and we had to switch to teleworking. And but we're actually doing pretty well. And then as part of this, we can also look at the trends. And so this board was created, so it looks at that data from the past, that last dashboard. It looks at it over time. And as you can see, like this is just for Department of Natural Resources. When they first shut everything down and they shut the parks down, it was causing, you know, the citizen impact was pretty, you know, we were down 30% of what we normally are. But now currently we're operating at a really good level. Same for our staffing, you know, we have good staffing right now. So this will be interesting, you know, as we get into the fall and the winter, and if cases increase like they think it will, you know, this will be a really good tool for us to have. As I said, we do have one full-time GIS person that is written into our public health emergency preparedness grant. And so just because you have that doesn't necessarily mean, yeah, that you're going to be included. But something that we really stress is getting involved in the conferences, the meetings, and especially like the exercises, just being there and listening and trying to determine like what they might need, and then to be able to quickly turn around and say, hey, you're doing this, but we could do it like this. What do you think? And being really open about that, and kind of staying out of the way but being present. I think that method has worked really well for us in emergency response and in public health. But just to make sure that they know that we're there, we're not going to be in your way, but we're going to give you really good stuff. And if you don't want it, okay, that's okay. We're here to help pretty much. And so I think that's kind of how we handle things on our side. So definitely all that data that we get from our local public health agencies. We wouldn't have anything if they weren't willing to put that data in there every day, 7 days a week. You know, I know they have so much on their plate and everything, but that data we get, it makes so many informed decisions for so many other people to share that out and up. I think that would be it.